I'm Dr. Michelle Plaster, and you're listening to Between Two White Coats, a weekly podcast where we dig into key issues surrounding health and wellness. I'm a family medicine doctor, and my co-host, Amber Foster, is a family medicine nurse practitioner.
In our combined 30 years in medicine, we've seen a lot. We are taking some of our biggest questions, obstacles, and patient-centered advice and wrapping it into a 20-minute weekly podcast. Make sure you hit subscribe so you don't miss an episode. If you have found this podcast helpful, give us a 5-star rating and review. This helps other people find our podcast. And make sure you share it with your friends. Thank you for your time. We look forward to serving you.
Thank you for sharing your time with us today, as we are so excited to have Grayson with us. Grayson is going to tell us his story as we continue to dive in to learn a little bit more about mental health and help people to understand that there is absolutely nothing to be embarrassed or ashamed about if it just so happens that your brain is not doing all the things that you would like for it to do. As we've said in our prior episodes in this season, that sometimes the organ that's not acting correctly is the brain. And to us, that is no different than if the organ that's not acting correctly is the liver or the heart. What we would like to do is start by having you tell us who you are and a little bit about you, and then we'll jump into your story.
Okay, great. So my name's Grayson, as Dr. Plaster so eloquently said, and I live in Atlanta. So I live in the city itself, in Midtown near Piedmont Park, living that young person life. And I'm 26. Recently graduated with my Master of Divinity from Mercer University's McAfee School of Theology.
That's a mouthful. That is a mouthful.
It is,
that is,
yes.
That's a lot to fit on. You have to have a master's so that it's
bigger
right? And can hold the name.
Do you have a plaque? That would be big.
Well, my dentist told me I had plenty of it.
Yeah.
But we took care of it. So Master of Divinity is essentially just like... but how you all had to get an MD to be doctors, and Master of Divinity is kind of like that for ministry or for counseling, nonprofit work, academic work in the field of religion theology. So that's sort of where my interests lie. Anything related to social justice, anything related to theology, which is partially why I'm very happy to be here today, because I think talking about mental health in a non-stigmatized, honest way is a just thing to do. But I also I love being in Atlanta and taking advantage of all the beautiful things and fun things it has to offer, playing guitar, being with friends, just all the things that a quote unquote normal person would like to do.
Right. And full disclosure, Grayson laughs when he calls me Dr. Plaster because we are cousins.
Yes.
And I love him very much. And I'm so grateful that he is willing to share his story with us because I just think it's a really impactful story.
Thank you.
So take us to where you were in life when it came to your attention that something just wasn't working right.
So it was 2013. That was my freshman year in college. At the time, I was at Belmont University in Nashville. My first time being away from home. My family all went to the same school that I actually ended up graduating from, Carson Union University, also in Tennessee. And so it was a pretty big deal, especially for my dear mother, who is your cousin.
My first cousin.
First cousin. Okay. For her baby, I'm the younger child of two, to go away to college. And I, was dealing with the things that freshmen first years deal with. It's a hard time in life. And I think we should probably talk about that more too.
Yeah.
It is fun and it's explorational, but it's hard.
Yeah. Well, it's transitional and it's grief too.
Right. Very, very true. Yes. And it's grief that I feel like, not to get too off track, but it's grief I feel like you're almost not allowed to feel, because everything around you is screaming at you. This is the best time of your life. Take every advantage of it. And it's like, but I'm also really sad.
Right.
So I'm sure that played into it. Lots of new feelings, new realities to process. But it really wasn't until I came out as gay in October of 2013. And then the aftermath of that, that some tendencies I had before to just overthink things or to worry about things past the point that would be considered rational or normal, those tendencies with all of those factors started to, I noticed, transform into something that was painful, I didn't know what it was. I didn't know how to control it. And I know that's not the best means now, but how to control it. And it really centered around, like, I remember the first time that I really was like, something really strange is going on, was actually me being, there's a thing called romantic OCD, which I didn't know at the time. I wasn't like, this is what's happening to me, with my encyclopedic knowledge of the DSM-5.
Right. And Grayson brings up the DSM-5, which it shows my age, was the DSM-4 when I was coming through school. It has since been updated, but this is the diagnostic manual for psychological or psychiatric illnesses. And so it sort of is the definition of different things. And so it lets you know, like, oh, that's the diagnosis that I might fit.
Right.
And so just to allow people to know the big words you're using.
Yes, thank you.
Big sister.
And so, yes. And so talk to us about, you were saying romantic.
And so it was me, part of the process of me coming to terms, fully accepting the idea and the reality of me being gay. Because I think those are two different things. You can accept a concept without really accepting how it's integrated into the whole of you and the whole of your life. WHOLE.
Yes.
Although my life did feel like a whole at the time.
Yes.
And it was me feeling very normal attraction towards and feelings for this straight male best friend of mine, conservative too, who I didn't feel comfortable talking about it. It wasn't like, hey, I think I might be attracted to you. And he's like, I know, I'm gorgeous. Someone who it would have been a problem.
Right.
And so all of that pressure, all of those questions of having essentially had a repressed sexuality for the past 18 years, the first 18 years. And then somebody, like, my sexuality was like a party guest who bursts in and just like, everyone's like, who invited this person? And changes everything up. So I just started noticing that I could not stop thinking about this person and what it means for why I'm thinking about this person and what could it mean if they found out. And oh no, I'm thinking about this. I haven't been thinking about this in a while. Now I'm thinking about it again. And all of those what I now know to call intrusive thoughts, obsessive thought patterns were intrusive, where it wasn't, as I know can be the case if I ever find a partner, where you just can't stop thinking about this person.
Right.
It was, I can't stop and I would like to.
And very much, I can't control my thoughts.
Yes.
I don't want this thought in my head at this moment. I can't stop it. It's starting to scare me or overcome me or keep me from being able to do the things I need to do to function as a freshman in college or whatever your state of life is at that time.
Right.
Well, just when you were just saying that, like how your thought was, I was like, that seems exhausting.
Yes.
Like, I was like, wow,
yes.
Like that must have been exhausting.
It was. Thank you. Yeah, it very much was. And it's really hard to describe even, it's 2021. I'm 8 years removed from that part. But it even when I wasn't like thinking the thoughts of this person, what does this mean? It was almost like, you know how when you cook with bacon, you cook bacon and then your house smells like it for like the next 2 days.
Grayson has not listened to our episode about healthy
eating.
eating.
Oh, when you cook turkey bacon.
Oh, yes, we can relate to turkey bacon, sure.
Turkey bacon.
Yes, as I know, that's only what doctors eat.
Right.
Of course, yes.
Yes. When you cook low cholesterol, fair trade turkey bacon, and it smells like it in your house, so it's like there's no bacon turkey
Still there.
Turkey bacon, yes.
Cooking, but it's still here.
Yes.
That's kind of how the thoughts were. Like even if I wasn't actively cooking the bacon, like thinking the thought, it lingered. Like the thought of the thought was still there. It was like there was a ceiling in my brain for how much, like if the normal ceiling's like here and these thoughts can just like move in and out and be fluid and operate as thoughts do, neurotypically, which means normal brain function, then my ceiling was like this, and the thoughts were just like ping-ponging, and there wasn't much room for anything else. And so, to your point, it was really exhausting, and it wasn't simply, and I'm jumping back and forth here, but it did get to a point where it was actually physically painful, where it wasn't simply like I'm feeling anxiety, which I know can be physically painful, but it wasn't simply an emotional thing. It was like actual headaches and actual bodily responses.
There's a couple of things that I really appreciate you saying. First, the physical presentation of what's going on in your brain. It is present for so many people, and there, I believe, are a lot of different medical diagnoses that come from this. Amber and I both have the blessing of really keeping moving in life and not asking for help and just, we got this.
Suck this up.
We got
I
this.
get that too. Yeah.
Yes. And so both of us, interestingly, recognize when we've sucked up a little bit more than what we should, because it will become a stomach ache.
Yeah.
Wow.
I had stomach ulcers when I was in my master's, and I couldn't figure out what was up. And I just internalized so much stress that it made me physically sick. Amber has suffered with lots of deaths in her family.
My dad, last year when my dad was so sick, he had open heart surgery and had, then he was diagnosed with cancer, and it made me physically ill because I was so worried. I would come to work all day and worry about my patients, and then I go home and worry about my dad.
Oh no.
Yeah.
So I just worried.
And when you came to me and said, I can't eat. And so I think that we get physical symptoms from what's going on in our brain all the time. I also really appreciate you describing what it felt like in your brain, because I think anyone who has their brain doing something different than what they're used to has a really hard time piecing together.
Yes.
What is going on here? How would I even describe this to someone? And will the someone even get what I'm trying to say?
Will they even believe me?
Or judge me for it?
Or judge me for it.
Right. Be scared of me, because I'm scared of me.
Yes. Yes. And how can I even articulate this or potentially make myself vulnerable to ask for help with it? And so it is, to anyone who's having trouble describing what's going on, that's okay.
Yeah.
It's hard to describe physical pain. It's hard to describe a lot of things that go on in our minds and bodies. So
go ahead.
No, go right ahead.
The benefit of physical pain, as weird as that might be to say, is like, this is hurting.
Yes.
When it's a mental, emotional, internal thing, it's like, this is hurting.
Right. My brain is hurting.
Right.
It's something's going on. It's hard to.
Right.
And when the area that articulates your thoughts is the area that's not working on your behalf, it becomes even more difficult to figure out what's going on. When do you get help? Lead us to then, so you're in this place, you're gone to college, there's a lot of stressors, which this happens for a lot of people, that you've been functional with a brain that wasn't always your friend.
Right.
And so when you, before we go forward with your story, let's reflect, when you had the gift of hindsight, did you look back and say, I had that a lot? Or
were there indicators when you were like, let's say a pediatric patient, like less than 18?
Yeah.
Did you have indicators then that you either masked or, learned what people will say, coping skills? Did you learn? I'm just curious, because that's at 18, we see a lot of mental health issues come up at that age.
And it may be brand new.
Yeah.
And it may be something that now, with all of the stressors of going off to college or a pandemic or whatever else may be surrounding someone, that I was very functional and I could handle that degree, but then it became a degree I couldn't handle.
So I do want to say, to your first question, that it wasn't an official diagnosis before I get into this question, because I didn't get to the first one. It was a friend of mine who had grown up with and is living with OCD. And I just was like, here's all the thoughts. And they were like, oh, it sounds like you have OCD. And it was the biggest relief. I was like, oh, that's what's going on with me. Thank goodness there's a name for it. So I did want to say that it was a friend, and that I opened up to this friend. But to the other question, so looking back, there were I think weren't not warning signs, but What was the language you used?
I just use indicators, like little red flags.
Yeah, little
Did you
red
have
flags.
little red flags?
So a story for that. I remember. I remember I used to be terrified of thunderstorms, which I think is pretty common.
Yeah.
But it was like a level of I can still remember how it felt to be as worried as I was. Which certainly means like there's an imprint somewhere in my brain of the chemicals left behind, the bacon smell left behind. And so thunderstorms, I remember there was a time we were at Hilton Head, me and my family, the four of us, mom, dad, brother. And I think I was 8, 9, 10, somewhere in there. And I unfortunately had gotten a stomach virus from my mom. And she got it before the vacation, and I got it on the vacation. So thanks, Mom.
I still remember.
Yes. And so while they were off at the beach having a great time, I was in the hotel room, posted up on a couch watching TV and going back and forth to the bathroom intermittently. And the hotel phone rang. And immediately my first thought was, oh my goodness, that must be the front office calling the hotel to let me know that my parents have been in a horrible car accident.
Oh, wow, yeah.
And so I remember, and at the time I hadn't lost my baby weight. So I was like kind of chunky. Puberty stretched me out for sure. I remember like putting on one sock. Don't know why I didn't put on both, but I put on one sock, not shoes, and walked on the black, like the hot black top to get to the hotel main office. But then like halfway through being like, this is ridiculous. Like you need to go back. But I think the fact that I approached so much as a kid with catastrophizing, which means like making the worst case scenario, having worry that I couldn't shake or didn't have the wherewithal to be like, oh, this is what's going on. And I was a kid. I don't blame myself. But the fact that that was my response to so much, I think could certainly be an indicator of a disorder in which anxious thoughts never leave you or are hard to manage.
Thank you for that. So your friend says, I've got this. Sounds like what you have. And you feel like, oh my gosh, maybe there is a solution. Maybe it's not just that I'm not controlling my brain right.
Right.
Then what happens?
So I believe, so this happened, like I mentioned, when I first started thinking something's really off, was like October, November 2013. This was January 2014. And it had gotten to a point where I remember like in the dorm I lived in, you could rent out classrooms, like to have movie nights with your friends or study movie nights with your friends. Study.
Right.
And I remember like gathering all of these, like my Bible and my devotional and journal. Because as I learned, one way that maybe people with other mental illnesses, but certainly with OCD, sometimes it's like God must be ordaining this because there's no other reason for why I'm thinking about or acting like this. And so I remember renting out the classroom and just like sitting in a corner and just crying. And so it had gotten to a point where I was like telling my mom, like in tears, like something, I don't know what's going on. And so when my mutual friend, my mom recommended me to talk to this person. When this mutual friend told me this, I started using that language, almost like testing it out, but it felt so good and such a relief to have just even something that it could be, as opposed to just, I am the most broken person in the whole world. And either that or God is doing this to me, something. And so I think the timeline that was my first time ever seeking therapy. And I used Belmont's, and many colleges and universities have this, their on-campus psychiatric services. But I think I only went twice, and he did provide some good advice. And but from there, I really tried to just soldier on. I really was like, well, I have the language, and I feel like it's getting better. And then there were some symptoms and effects that, because they weren't the worst of it, because I wasn't crying in a corner in a rented out classroom, that it wasn't worth bringing up, or it wasn't worth addressing. And so my personality is just this is yet another thing to be good at. This is yet another thing to overcome. This is yet another thing to push through. I'm an achiever. I didn't let my grades slip. So I must be okay, because if I weren't okay, then I would be having bad grades.
Right.
So it's almost like I create the reality that helps me continue to not treat myself well.
Did the therapist confirm for you, yeah, I think you have OCD, or were you just sort of existing with your, it seems to fit that? And
if I remember correctly, he wasn't like, I think you do have this, because as the years went on, I had to further confirm for myself, like, oh yeah, this really is what's going on. And I don't know if that was the therapist or what I let them in on.
Mm-hmm.
But I don't remember it being like, you have OCD, let's refer you and get you some medicine. Like, that was way down the road.
Gotcha.
And it was just something that I just lived with. And the summer following was really, really difficult. And I had all sorts of kinds of OCD. There's harm OCD, where you are like afraid that you're going to hurt someone, even though it's just that you had like a fleeting thought that so many of us have, like,
Mm-hmm.
I could drive into oncoming traffic. No, it won't.
Right.
So many kinds of OCD, and it was just like, it was exhausting. And it was, the whole summer of 2014 was basically defined by what was going on in my head. But then it kind of tapered off. And so it was something that I could manage and live with. And I think I still had some of that stigma around, like, I was going to therapy, but wasn't like thinking I needed medication. And it really wasn't until the summer of 2019, so just a few years ago, that a friend like said, why don't you just try medicine? And I was like, why don't I?
Right.
That's a great idea.
Right.
Right.
Do I wish for my life to be harder than it needs to? Or
Exactly.
might there be a solution that
Exactly.
I don't have to work so hard all the time?
That's exactly it. I remember saying, I feel like I have to work for my joy. I feel like I have to work to feel at peace. In certain environments, it wasn't all the time, but I think the places where I was most vulnerable, or like was most seen, so with family, that was when the symptoms would be the most present.
Which is interesting to me,
Mhm.
because, which I guess being vulnerable, but it appears, and I'm making an assumption here, but like,
Mhm.
you went on family vacations, like, you kind of had like mom, dad, brother, like, it's interesting to me that is when the symptoms would come up. Is it because you could be more vulnerable at home, or did you feel like pressure? Does that make sense?
I think both.
Okay.
I think there was more of a pressure, especially on family vacations. And the summer, actually, that I ended up getting medication, we went on a beach trip, not to Hilton Head, although that's where we continued to go. This one was different, where I was having, I don't know if I'm sure there's a term for it, but I would say it's like issues OCD.
Mm-hmm.
And so for me, it was, and still to some extent is, like climate change. That is something which is understandably anxiety inducing,
Mm-hmm.
but it was something I literally couldn't stop thinking about. I would like almost categorize everything as like, that's going to drive us closer. This Target is full of stuff that none of us needs, and this is going to bring us closer to the brink. Like,
That is not what I think when I go into Target.
Not
so,
me
I know, right?
anymore.
Not you
I'm
anymore.
like, now I'm like, I think I do need all this stuff.
I know, right?
And I'm going to spend
money you don't need.
Right.
Things you don't need.
And so I remember getting to the beach and looking at the water, which is quote unquote supposed to be like so therapeutic
Right.
and calming, and thinking, this is what's going to flood us in 10 years.
And we laugh because we can
Yeah.
laugh.
Yes,
because
yes.
You're doing great, but
I can't
but
imagine.
it's that is honestly where I think people can have a lot of insight to. When I'm having this thought that I go, okay, that's not what is supposed to happen in this situation, is a good time to say, and it doesn't have to. It doesn't have
right.
to, and it doesn't have to keep happening. I should be able to look at this beach and feel the relaxation that this beach is supposed to bring me, but I'm not. And so there's more that should be done.
Mm-hmm.
And I hear you saying and appreciate you saying that you had good days, that you had days where you thought, trucking through just fine.
Right.
And that you were highly productive and you're getting good grades and you're on paper looking like it's all fine. So it must all be fine.
Mm-hmm.
And, that's like a diabetic saying, I have days where my sugar's fine, but then we get their A1C and their 3-month average is not fine at all.
Yeah.
Well, guess what? It's still eating up your kidneys and it's still doing damage.
Right.
You're allowed to have good days and still know that you can do better, and that it doesn't have to be that hard on the bad days. So I think, huge message to people. Don't be ready to do something and then have a good day and think, I don't really need to do anything at all. It's vulnerable. It's difficult to get in front of someone and really admit that I think I need something more.
Yeah.
I'm maybe not as good as I'm putting out there or believing even myself.
And that's a very good point. And at that point when the friend recommended, former friend, but they did do one good thing. They
Serves their purpose.
Right. When they just said the thing so simply, why don't you just try this? I had been in the best, most consistent therapeutic relationship of my life. Like, it was on Mercer's campus. And we really got into things, and I could be fully on. It was a great relationship. And I think that ironically kind of played into it too, where it was like, well, it's like I was playing self-care grades. Like, well, I exercise and I eat well and I get enough sleep and I'm going to therapy and I meditate sometimes and I do all these things. And so it got to the point where I was like, and that's okay for that to not be enough. Like, yes. But I was using it in a way of like, we were
controlling it.
Yes.
It's part of the OCD.
And
check.
Right.
And all the stuff that's fed to us. And if you do all these good self-care things, your brain will be okay. And that's not how it works.
No.
If you eat right and exercise, you can still have diabetes.
Right.
If you do all the great self-care and meditate and you do all these other things, it doesn't mean that it's going to put you into the place that life still isn't harder than what it should be. So you went to, at that point, what kind of doctor did you see, and how did you decide to do that visit, and what happened in that visit?
So let's see. So the former friend, told me that I think in, I want to say July of 2019, June or July of 2019. And there were also I'm not going to get into this, but there were a lot of life circumstances unrelated to OCD, that were certainly making it, worse.
Which I think really brings us back to that freshman year. A lot of people are high functioning and they're just doing great in life.
Yep.
And then it's those life circumstances where you realize it was already hard.
Yes.
Now it's too hard. And you got to be existing in life's okay, and then when it gets hard, you're okay. But when you're working really hard to keep it together, and you're keeping it together, that doesn't mean it's not really hard. And when you can feel that it's really hard, it's still a good time to go ask for help before those life situations come in.
Absolutely.
So you have life situations again, which has really thrust you into realizing things that you had not had to realize as much prior, and went to your primary care, or?
So actually, I think I just Googled, psychiatrists in the Atlanta area. And of course did the filters. I think probably Psychology Today, their database for therapists, psychiatrists and other mental health professionals. And of course, did the filters for OCD, who's in network, all of those things. And saw one who was in the, I think, Dunwoody area, and was just like, okay, I'm going to do this. I'm going to see if this is what I need to do. And visited and explained just some of the things I explained earlier. And just a brief history of my OCD and me. Sounds like a
commercial.
Yeah, or a bad romantic comedy. And we talked about it. And at that meeting, and I also explained, I think this is probably important, that a cousin on the other side, of my family, had taken medication for depression at one point. I just knew that had happened. And thinking about like, wow, I mean, I think so many people in my family probably have undiagnosed something.
Absolutely.
Especially with, my granddad. So my dad's dad, having been a veteran of World War II, Like, who knows
Yes.
how much?
Yeah.
He just
And
had
this is true of so many families because a generation ago we didn't talk about or
Right.
diagnose this, and still, people who aren't diagnosed. You and I share a relative who has hoarding OCD.
Yes.
And however, we just called those people hoarders, and yet that is a kind of subcategory of OCD.
hmm
And so there are people that exist in our families that don't have or share that they have this diagnosis. So I think that's true of every family.
Yeah.
If 25% of the world struggles with some mental illness, then don't you think it'd be 25% of your family? It sort of applies.
Right. So that was actually helpful for me, just to be like, because I feel like if you think, wow, I had no say in this, like my aunt on that side and all of these people on that side probably had these, and I'm cursed with, or it's like, wow, like this is the hand I was dealt, and in the same way that this is the body I have, and I try not to do things to harm it. This is just what the context I have been given, and thank goodness there are ways to address it. So all that to say, I told him about that history, and I think at the time he said, all right, let's try Lexapro, and I take the generic version, escitalopram,
Yeah.
which I like to say because I'm proud of memorizing it. And we started out with 5 milligrams. And so it's a very tiny pill. And so you would cut it in half, and then it was like a half moon. And then for the first week or two, I tried Lexapro and understood that this may not be the best fit. But fortunately for me, it was. I had very mild symptoms as it integrated. I just felt very emotional all the time. And like,
Which is very common.
yes.
Like I warn people of that.
Yes.
It's a common side effect when you first start medication.
Mm-hmm. And it was just like, I felt like anything, like a commercial, a puppy would like make me cry, which is still kind of true even when I'm on medication. And then might be TMI, but I think it's important to note SSRIs, which stands for
Serotonin reuptake inhibitors.
thank you,
You're welcome.
doctors. That is the category that Lexapro and other similar antidepressants are. Can sometimes make orgasming more difficult, and I noticed that as a side effect. So
There are a lot of sexual side effects.
Yeah.
And a lot of people will stop taking the medicine because of that. And then that's another vulnerable, difficult thing to talk about.
Well, and it's weight gain too. So I always tell patients,
Yes.
if you're going to gain weight and you're not able to have a normal sex life that you were accustomed to, then you're not going to take my pill. So
Yeah.
we've got to talk about it.
Right.
Wow.
And so it is super important for you to get back in with your medical provider who prescribes to you and say, guess what? I don't like this one because
Yeah.
it's causing me to not
Problems.
have an enjoyable sex life, or it's causing me to gain weight and I don't want to do that. So then there are other options.
Right. And so fortunately for me, TMI, those subsided eventually.
And that's another really important point is that
Yeah.
initially when you start medicines, your body's very naive to it and you'll have a lot of side effects that go away in a short period of time.
Mhm.
Yeah.
And so it's sometimes good to say, you know what, I'm just going to commit to this for a month before I make a lot of hard decisions. Of course, if it's making you feel terrible, we don't want you to keep taking it
Of
for a month.
course.
But a lot of people will, the first time they get a headache, I don't want to take this.
Mhm.
Or it's not working because I didn't feel good tomorrow. It takes 3-4 weeks,
Yes.
sometimes 6 weeks
Mhm.
to get a maximum effect. Sometimes people at 2 or 3 weeks will think this isn't working. We often like to start, like Grayson was saying, break this tiny pill in half. We like to start at a low dose because
Mhm.
you're more likely to have fewer side effects at the lowest dose, but it's less likely to be therapeutic.
Right.
And so we've got to get you used to it, and then we might want to titrate it up. And so Amber and I always like to say, come back in 3 or 4 weeks.
Mhm.
Let's keep seeing each other regular until you tell us that you feel like you want to feel.
And on the opposite side of that, if 5 milligrams works, I don't want to keep titrating you up either. Like I want the
Right.
least dose,
But
most
let's-
effective.
Exactly. Let's do the lowest, most effective so that we can,
Mhm.
because you always have potential of more side
Yeah.
effects at a higher dose.
Right. And so I'm now, and have been since 2019, been 10 milligrams a day, once daily. So in the morning, I get my multivitamin and I get my Lexapro, escitalopram, and just take the pill. And I do want to mention what you said at the beginning, that the pandemic, the ongoing pandemic, but certainly when it was more new and we were in lockdown, and hand washing was such a topic of concern. And I also do want to say that I also didn't, so tangent to the tangent, didn't identify what I was experiencing as OCD because of how it's so popularly misconstrued.
On the movies.
On the movies.
Washing your hands on the movies,
Checking
locking the doors, checking the stoves.
Right. What is that? Jack
Nicholson. Yeah.
And,
I don't remember the movie, but yeah.
But yeah, if you don't flip the light switch 13 times,
you don't have OCD.
It's not OCD.
Right.
Yeah.
And it's cute. It's like, oh, that's just a little quirk he has.
Yes. Or people will use the term OCD almost as a compliment to themselves because they're a perfectionist. So if I'm a perfectionist, I have OCD. I have OCD. And we all throw that around. I must be OCD.
Or I'm obsessed with this new show.
Yeah.
Right. It's like, no, is it keeping you up at night? Are you having intrusive thoughts and crying in a corner? No.
Exactly. So did you receive the diagnosis of OCD when you saw the psychiatrist?
I think I gave them that. I was like, I think this is OCD. And they were like, I think you're right.
Yeah.
Yes. And so that was really the first time that a psychiatrist put down on paper, this patient has OCD or is experiencing obsessive compulsive disorder. Which what I was getting at is it's sometimes called pure OCD, where it's more just the thoughts themselves or the compulsions. The
obsession without the compulsion.
Yes, but it's still OCD. And so that was difficult for me because I didn't have those external markers.
Yes.
So that was the first time, even in therapy with a psychologist, with a therapist, we talked about it and we just kind of accepted that was what it was, but it still wasn't on the form officially until the psychiatrist agreed with what I told them and then prescribed the medication, said the same thing, 3 to 4 weeks. We'll up your dosage if we need to. They did. And the side effects subsided. And now it's just a blessed and regular part of my life. I actually, as weird as this may sound, and I do want to acknowledge, I had support of family. I lived in a stable environment, had stable income. So had I had a harder time in 2020, I would not have been as okay as I was.
I know. I was thankful that you got on medicine in 2019.
Yes.
Yeah.
Me too.
I mean, I couldn't imagine.
Yes.
And so to that point, with all of those, external factors and privileges and blessings in mind, my mental health in 2019 was far worse than it was in 2020. I was able to approach 2020 with, a healthy amount of anxiety, a healthy amount of stress, because it doesn't make you numb. If it does, you probably need to try something else. It doesn't make you superhuman where you only feel the good things.
Right.
But it helped me just to be able to process, put where in my brain where these thoughts need to go, and can relate to them and not have them dominate over me.
And be so exhausting.
So exhausting. And so I was like, wow, if I can feel at peace within my own world, even when the world around us is chaotic, to say the least.
Yes.
That, I think, is a sign of growth and of mental health, where it's not like this isn't affecting me, but it's like, am I okay? Am I processing this well? Okay. And there is something going on. There is crisis. I accept that, but I am not so laid out by it. I'm not so unable to escape it, even in my own mind.
Yes.
And that is a direct result of having been on medication, continuing to take it, adopting healthy practices, having been in therapy. Because it's not, I think if I had just taken the pill and that be the fix, I wouldn't be as healthy. Right. If I had just done therapy, I wouldn't be as healthy. I see the medication as just one piece of a larger wellness puzzle, so to speak.
Absolutely.
And that proved to be true in 2020, where I was healthier mentally than I was before the pandemic.
Right. And it went to say that you could deal with those extra stressors
yes.
that life hands us no matter what, when you had maximized your resources.
Yes. I could handle the stress more. And also other things like not watching too much news, like
Right.
choosing a news regimen that is helpful to me, since so much of my OCD became how wrong the world can be.
Right.
So, it's all a process, and the pill, like I said, wasn't the magic bullet. It was
A tool.
a tool. Yes, exactly.
Yep. Grayson, thank you for taking us through that. And thank you for telling your story with pride. And I hope that other people hear this and realize that there is nothing about our stories to be ashamed about.
Nothing.
We are going to continue with Grayson next week in our next episode. And we're going to talk a little bit about how does Grayson get to a place that is not a stigma view of mental health. And we're going to dig a little bit more into OCD and what is it really? It's not when all of your pencils have to be the same length. It's more difficult than that, because I think people have a misview of what OCD is. So let's dig in a little bit to understanding OCD a bit better as well. We want to thank Grayson for sharing his story with us today, and we hope that you'll tune in for our next episode when we hear more from Grayson. We like to finish every episode on a positive note, and today's Tell Me Something Good is that there is help available. No matter what you're going through, there are so many opportunities to heal. We believe strongly that light always comes into the dark. So whether it is through therapy or medication or that friend that loves you enough to help guide you to help, know that there is light that will come into your dark. We thank you for joining us today, and until next time, take care of yourself.